is Maggie Felton. She is a nurse with Vanda Pharmaceuticals. And she's here. She's been here before. But we welcome her back to update us on new information about the disorder known as non-24 sleep-wake disorder. It is about the fact that, when you sometimes have limited light perception, it's going to affect your sleep, your circadian rhythm. So she will talk about how that happens, how that occurs, and hopefully give us some good tips on getting a good night's sleep, and learn about this disorder to anybody who's new and never heard of it before. So it's really good to know about, good to find out about, and what treatments might be available. So I'm going to go ahead. Can we go ahead and get started? Yeah, Maggie, if you're ready to begin, let's welcome her.
All right, I really like this microphone. Every time I get a microphone, I want to do some stand-up, although I'm terrible at jokes, and I've tried it before. It never works out, so I'm not going to try today. I'm gonna move on. But
You're not telling us a joke.
I'm not going to tell you a joke. I've tried it
Did you hear the one about the three
before.
blind people that walked into the bar?
What's that?
Did you hear the one about the three blind people that walked into the bar?
Go ahead.
It hurt.
I'll leave that one alone. My name is Maggie. I am a nurse. I'm also a nurse practitioner, but today I am here in the capacity of a nurse educator. And I am with Vanda Pharmaceuticals, although I am not here. I don't sell or promote anything. My goal is simply to do education and awareness. So I'm under a blanket of awareness and education. So my goal today is to share information with you guys. And I hope that you walk away with something that maybe you did not know before, okay? And hopefully some tips on how to improve your life by improving your sleep. So I've been here before, it's been years, I recognize some faces. And if you're newer than me, then welcome. I'm happy to be here. Also, I'd like to tell always before I kind of get started, if you guys hear an accent coming from me, I will just tell you what it is. Sometimes I play a game where I have people guess where I'm from. That's a lot of you guys, so this may be lengthy. But sometimes people think I'm from the South. When I'm in the North, they think I'm from the South. When I'm in the South, they definitely don't think I'm from the South. But every now and then you hear it, so if you hear it, just ignore it. You can laugh at me later if you'd like. But if I say something off, it doesn't make sense, just let it be. I was born and raised in Poland. I've been here most of my young adulthood. I moved here when I was 14. And so if I spend a lot of time with my folks over the weekend speaking in Polish, then all sorts of stuff comes out of my mouth. So, and I did that this past weekend. So just giving you guys a warning. So I wanted to kind of start off by doing two things. One, I'm going to share some information with you guys, but my goal today is that this is going to be more of an interaction than just me sharing information. So I hope that you guys are ready to participate, and feel free to whether yell out or raise your hand or whatever floats your boat if you'd like to share something, okay? If you guys could raise your hand for those who have heard me speak before. Couple people, okay, all right. Great, thank you for sharing it. And what I typically talk about is a condition called non-24, and that's NON, and the number 24, and that's non-24 circadian, which is a sleep disorder. If you could raise your hand if you ever heard of it. Okay, a couple of people have heard of it. Okay, very good. Anybody would like to share anything? You don't have to. Would like to share anything that you may know about non-24? Yes, sir,
I guess it's,
Philip.
I know it's a sleep disorder, and sometimes people just have trouble because of day and night falling asleep or whatever. I've never really had trouble with that, but I don't know a whole lot about it, but that's what I've heard.
Thank you, Philip. You're exactly right. You're exactly right. So, typically what we want to kind of figure out, what is your relationship with your sleep, essentially? Anyone here struggles with sleep at all?
I do. Sometimes,
Excuse me.
sometimes I sleep, for a whole week I can sleep great. I doze right off. And then other times I might stay awake each night for 2 or 3 weeks. Seems like I just can't shut down. And I don't know what's causing that. And I don't take medications to sleep. I'm a diabetic, and I don't want my sugars dropping. Then I'm on a sleeping pill, and I don't worry about low blood sugar.
Sure.
But yeah, I have because y'all don't know my story. Sometimes it keeps me. I've been through a lot of trauma. Yeah, I do have a problem sometimes sleeping. And it's severe. Sometimes I don't get to bed. I go to sleep around 5 o'clock in the morning, and then in a couple more hours I'm back up. So I only get like maybe 4 or 5 hours of sleep, maybe 3. And I'm trying to figure out what to do about it. So I don't know. That's it. It could be a little trouble. But I think I was trained because I didn't sleep good. Yeah. Where does it come from?
Thank you. Thank you for asking that, Mr. Lee. I appreciate you sharing that example. Very common. I hear it all the time. And I'll try to share with you guys where potentially what are some of the issues, where they come from, and how is that related to eyesight or lack of eyesight or diminished eyesight or diminished light perception. Because there's a very important connection there. So thank you for sharing that.
So eyesight has a lot to do with your sleep.
Yeah. So So that brings me to my next point. Sleep. Sleep is so important to our everyday just living, right? We all know that sleep is one of the main things that you truly need to help you feel healthy. So having a good night's sleep is extremely important for cardiovascular disease, heart disease, any respiratory diseases, inflammatory diseases, mood disorder, and so forth. Sleep is very, very important. Well, lack of sleep causes the opposite, right? It causes a lot of issues. But why do we talk about it in this community? Blind community, people who are visually impaired, have a very significant connection to lack of sleep, and it's very common. And the reason is there's a direct correlation between our eyesight and ability to sense light perception and ability to sleep. So let me back up a little bit and give you a little bit of science how this works. Why are people who are visually impaired struggle with this more than anybody else in our population? Where our eyes have these special cells in them, okay? Every morning when we wake up, our eyes sense the sunlight, the daylight, okay? And they send a message back to the brain, to the hypothalamus, telling the body, hey, it's daylight. And that's essentially how the body knows it's daylight. But when the sun goes down, the brain gets a message, hey, there's no more sunlight. And that's how the body knows essentially it's sleep time. So for most people, every single morning when they wake up, they live in this 24-hour daytime, nighttime cycle. Sleep, awake during the daytime and sleep at nighttime, right? But what happens if someone doesn't have light perception? What happens if someone can't sense there's daylight outside and the body doesn't get the message? And what happens if someone maybe has some light perception, but the cells are not working quite well, so the message still never gets there? Well, this could be even a fully sighted person that maybe suffers from something like traumatic brain injury, right? They may have sight, but the message still never gets there. So what happens is the person lives in their own personal circadian rhythm, okay, their own personal clock. And so for most of us, we live in a 24-hour nighttime schedule, and then nature has developed a way to keep us all in the same schedule by sensing this light. But believe it or not, we all have our own personal circadian rhythm, and it's typically more than 24 hours. It's 24 hours and 5 minutes, 15 minutes, 30 minutes, whatever, okay? For the most people, every single morning, that extra minute get erased. But if you're not able to tell there's daytime or nighttime, you're not able to sense the light, or the message never truly gets to your brain, the body lives on its own personal clock. What does that really mean? William, I'm going to use you as an example, if that's okay. So let's say William, his personal circadian rhythm is 24 hours and 30 minutes. And so he wakes up today, and his body can't sense the daytime or nighttime. And so he puts himself on a schedule. He goes to bed at 10 p.m. every single night because he wants to be healthy. So when he goes to bed at 10 p.m. tonight, the body says, okay, we're in the beginning of our clock. We can go to bed at 10 p.m., not a problem. But tomorrow when he wakes up, that extra 30 minutes that he has doesn't get erased. So when he goes to bed tomorrow night at 10 p.m., the body says, oh, I'm not quite ready at 10, but I'll be ready at 10:30. Not a big deal. But the following night, it's 30 minutes later. It's 11 p.m. The next night's 11:30, and it's midnight, and it's 1 a.m. and 2 a.m., so on. So before you know it, his days and nights are upside down, right? And this kind of continues till his clock aligns again. So the symptoms of this condition for non-24 are things like inability to fall asleep or stay asleep, okay? And in fact, a lot of people will tell you when they try to go to bed at nighttime, they lay down, they settle in, they tuck themselves in, but the eyes just won't shut. The brain won't stop wandering. The brain is very, very active. And they try and try and try, and then eventually give up. They give up and they get up and do all sorts of things at nighttime. Raise your hand if you have ever done your laundry in the middle of the night, or the dishes, or any cleaning, or vacuuming, right?
That's what I do.
Folding laundry. Somebody has told me once they mowed the lawn in the middle of the night once. Yes, it's a scary thought, but
That went over good.
it has happened, right? I don't know if they have neighbors or not, so. I mean, your body's very active. And so, just like it is for most people during the daytime. And in the same token, during the daytime, you have a very difficult time staying awake. And it's because your body thinks it's nighttime. And for the most part, if we're moving around, we're okay. But the moment we sit down and stay still, the body takes that opportunity to shut down because it needs to rest. That's when our bodies rejuvenate. That's when our bodies heal. So it's going to take any chance it gets to rest. Okay? So when people with non-24, they'll tell you they have sleep cycles, sleep schedule that's just different from people around them. Okay? And the sleep schedule changes every night. It's not always the same. So they may have few good nights of sleep, but the rest of the time, it feels like it's all over the place. It can happen to men and women equally. Okay? It can happen at any age. You can be born with it, but a lot of people get a diagnosis later in life as their eyesight progresses, as they start losing their eyesight. That's when the symptoms start to become noticeable. And some people have symptoms that are very significant. They know there's something serious going on with their sleep. And some people's symptoms are not as significant. They're more milder, okay? So in the community of visually impaired, this is very extremely prevalent. In fact, people who are totally blind, statistics tells us that 7 out of 10 people will have this. 7 out of 10, that's huge. Totally blind, have no light perception. But this is not exclusive to those who are totally blind. Oh, in fact, we see a lot of people that have this, they get diagnosed before they lose their eyesight completely, and we even have some people that are fully sighted. Like I said, like perhaps veterans have traumatic brain injury, so they may have sight, but the message never truly gets there, right? That makes sense so far, you guys? Anybody sleeping? I love to do these talks right after lunch. It's my favorite time. It's my favorite time, yes. We already have a hard time sleeping, then you add some lunch to it and try to stay awake, right? So I will not make you guys get up and do jumping jacks. I will not do that. But I am going to move on to some questions so far. Did you have a question right here?
Well, I'm not 100% vision impaired, but my vision is poor.
Me and my
Right now
caregiver,
on
we have to go.
right now I'm maintaining seizures. Like I do take it, but usually I wonder if it's because of the sleep patterns, does it have something to do with the seizures? Usually it happens in my sleep.
Oh, your seizures? You mean
We
your-
didn't hear that question.
Well, we can't hear.
So
Can you-
I think the question was, is there a correlation between seizures and lack of sleep, or they're not 24 perhaps? Is that what you're asking?
Well, I guess so because I do have I am vision impaired. However, like the lack of sleep, my sleep pattern is really messed up. And usually, when I do have seizures during my sleep, I don't know. Like usually, I wake up in the hospital with somebody scratching my face in my eyes, and it's like I take medicine now. It's maintained, but I'm just wondering, does that have anything to do anything with because of the lack of sleep with the seizures?
Well, there are triggers to seizures, right? So people often have different conditions have different triggers, right, into seizures. So I guess it depends what your triggers would be. You know, a lot of times they tell you like bright lights or flickering lights could be triggers, but lack of sleep, perhaps it's one of the triggers as well. Yeah, it's not necessarily uncommon. I don't know if I have right top of my head, any data to support that, but I mean,
I do have multiple sclerosis.
yeah.
But I just didn't know because like it's maintained now, but when they come, they
Mhm.
come, and I don't know if they're having because I'm in my sleep.
Mhm.
And I don't know if because of the sleep, does it have anything to do?
It's a complex condition, so multiple sclerosis, lack of sleep is a trigger for seizures. Yeah, for sure. Yeah.
Stress and like.
Yeah, absolutely, absolutely. Any other questions, you guys? Yeah. One question right here. Yes, sir.
I dream all the time, and when I'm sleepy, and I've done that my whole life. Is that normal?
Yeah, I sure hope so. What kind of dreams are they? Good or bad?
No, they're okay. I own a business. I've owned it for a long time, and I would dream on the best way to do what I've got to do that next day.
So your brain never shut down. Your brain's up even thinking when you're sleeping. Yeah. Yeah, so we make two major hormones related. I'll come to you just one second. We have two main hormones that we usually think about when we think about sleep and wake cycles. The very first one is cortisol. Cortisol is our active, alert, awake hormone. We make that most of the day. In fact, we make majority of it first thing in the morning. And then as the day progresses, we make less and less. But cortisol is really the alert, awake, active hormone. And of course, you have too much, that's not good. Everybody says, oh, cortisol, stress. But we need a good amount of it for healthy reasons. And that's what keeps us awake. But at nighttime, we make something called melatonin. You guys heard of melatonin? Yeah. A lot of people correlate the melatonin you take, by now. But melatonin is what helps us fall asleep. And so we make that in the evening. So, and we make that early in the evening to help us kind of fall asleep, not necessarily stay asleep. So when you have active dreams, your cortisol might still be in your system trying to think through all those things you have going on, right? So it's probably very difficult. You probably have, probably take naps too, don't you? Yeah. Okay, yes, sir.
Well, I am not visually impaired, but I don't think I have the what you came here to talk about, that
924.
But I do have what you talked about up there about laying down to go to sleep. You feel sleepy, but you lay down, you get all comfortable, and you can't go to sleep for hours and hours. And I just think about everything in the world, what I'm gonna do the next day. And if I do need to get up early and I need to sleep, I'll take some kind of sleep aid. And I was wondering if you knew what a good sleep aid was and or bad sleep aid or anything to help with that.
Good question. So question is sleep aids. So I always kind of want to say I don't necessarily promote any drugs, and I kind of try to stay away from that just because I don't want anyone out there to think I'm promoting one drug of treatment over another. But sleep aids are very common that people use, right, to help them fall asleep. But one thing that we can talk about is some of the natural holistic things that we can do to help us fall asleep first, right? What can we do to help our bodies relax and optimize our sleep? What do you guys do? Anybody here does anything special to help them sleep? I know you guys do. I know you want to tell me. Yes, ma'am.
Well, I can turn on a book,
All right.
and I don't turn it on too loud, but loud enough so I can hear it, but not loud enough that I'll start getting into the story too much, you know what I mean? Yeah.
Yes.
I
Yes.
I don't mind missing the story.
Yes. Audiobooks are great, very common. People use audiobooks all the time to help them fall asleep. And the reason is, our brains, you guys, our brains are like sharks. They're designed to fix a problem that you may have. That's their job. Because when you have a problem, something that worries you a lot, it causes you stress, which means it causes your cortisol to go up. Cortisol is inflammatory. That's not good. The brain says, oh, no, I don't like cortisol. I need to get rid of this cortisol. So what am I going to do? I'm going to fix this problem that's worrying you. So when you try to go lay down, go to sleep, the brain says, oh, no. We're not going to sleep till we fix this problem, right? So no matter how hard you try to forget it, the brain's going to take you right back in there, and you keep telling yourself, I don't want to think about this anymore, but the brain won't let you, wants to fix it. So something like an audiobook is fantastic because it distracts you, right? Distracts your brain from the problem and allows you to focus on something different. Yes, Kimberly?
I make sure before I go to sleep that I stay off of my electronic devices.
Ah, good one. Stay off electronic devices. So did you guys know that electronics give off this light that actually stimulates the cortisol and suppresses your melatonin, the sleepy hormone? And guess what? If cortisol and melatonin were in a fight, who would win? Cortisol, right? So that's why they always tell you turn off your electronics because it just kills off your sleepy hormones. Miss Linda, did you want to? You had a comment earlier.
No, I was just saying the audio,
okay.
audio books, yeah. I
Audiobooks.
put on my 15-minute timer.
Okay. All right, Mr. Phillip.
I got a question, like sometime if you ate a big meal or whatever, sometime, do you have trouble like if you eat a real full course meal or whatever right before bedtime, is it sometimes hard to fall asleep?
Oh yeah. Oh yes.
That's
for
what
sure.
I thought, I don't usually do that, but I've always thought that or whatever, that may have been always, like if you eat about 8 or 9 o'clock, that could have something to do. I was with a group one time that did that some, and I just always thought that was tough falling asleep.
Yeah, and the reason is, although we just ate a meal and we're very sleepy, right? But if you ate a meal at nighttime, right before you go to bed, and by the way, it takes about 4 hours to digest a full dinner. And I mean like a steak or chicken and some potatoes, that's a long time. So imagine if you just ate a full dinner and then you lay flat, what's gonna happen? Body's not gonna like that, because remember, you're moving this way. So what are you gonna get? You're gonna get some acid reflux, right? You're gonna get some chest pain, right? So, and it's going to burn. It's gonna keep you awake. Your digestive system does not like that. So, And that's why you should not eat too close to get in your bed. Thank you. What else? What else do we do? Yes.
Last night I was having trouble falling asleep. That does happen to me occasionally, and I couldn't pinpoint it. I said, I didn't have coffee late. No alcohol either to help, stimulate the sleep back and forth again. And I had eaten a light dinner, so I thought, maybe I'm hungry. So I got up and fixed myself a piece of toast with peanut butter on it, and I went back to bed. And pretty soon after that, I don't remember anything, so I must have fallen off to sleep. So
Okay.
it's good.
Excellent. So it worked for you.
Yeah.
Excellent. Yeah, I guess we don't want to be hungry either, right? What else? Anybody here uses white noise or no noise? White noise in the background, like a fan blowing, right?
No.
Yeah. So sleep hygiene, which is a fancy word, things we do to help us sleep. It's very personalized, right? What may work for me may not work for you, and vice versa. But some people need their white noise. They need that fan in the background to tune out all the other noises. But some people need no noise at all, right? They cannot sleep with the noise, right? So it's a very personalized approach. Yes, ma'am.
My days and nights are mixed up, and I don't know how to reverse it. Like during the day, I'm usually asleep, and at night, I'm wide awake, and I just don't know how to just function. Like maybe I have appointments or just different things I have to do for the day, business hours. And sometimes it's difficult just to get up every day, and especially like with the medicines and things that I take. I don't know. What do you suggest to reverse?
Yeah, so great question. So tell me your name. I'm sorry, I didn't see your name tag. Aisha. So she said her sleep is all over the place. It's upside down sometimes, and she does not know how to reverse it, kind of realign it back. So I always tell people the first thing you want to do is you want to do all the natural holistic things first, right? You got to try those things first. Optimize your sleep in the best way that you can to see if you can make it better. If not, you move on to the next step, right? The next step, you got to figure out what is causing these sleep issues, right? You got to find the root and cause, right? Sleep is hard to diagnose because we don't really have good tests out there to tell you whether you have insomnia, whether you have sleep apnea. So we have one test really for sleep apnea, but anybody had a sleep study before? Yeah, they're not great. I mean, but that's the only two we have, right? They hook you up with these things, and they tell you, go ahead and sleep and I'll watch you, right? You're already having a hard time sleeping, right? So I'll hook you up to all these things and monitors and cables, and they say, go ahead and sleep. It is very hard. So we just don't have great tools. So very often, sleep is diagnosed simply by symptoms. Talking to your provider, talking to your doctor about your symptoms. And a provider does, it tries to differentiate your symptoms into something that they believe you may have, and they may do some testing to exclude some things. So, for example, like sleep apnea. Anybody here, you don't have to say it if you don't want to, yep, but sleep apnea is something, most common symptom is snoring. Do you snore? Yeah? Did your partner ever tell you to snore? Can't breathe, yeah. But, sleep apnea, the treatment for sleep apnea is a CPAP, right? It's the breathing machine. People either love it or they hate it, but that's the treatment. It's really not a sleeping disorder, it's more a breathing disorder. But we call it sleeping disorder because it prevents us from sleeping, right? But insomnia, another sleep disorder, what are some of the roots and causes for insomnia? Could be stress, could be anxiety, could be stress and anxiety, right? Could be medication. Could be something that you put on that makes you get up to go to the bathroom in the middle of the night. Anybody ever had to take Lasix? Ugh. Yeah, you got to get up in the middle of the night and go to the bathroom. How are you supposed to sleep, right? Could be some aches and pains. Maybe you fell 6 months ago and you still have a little ache there that may wake you up. So there's a lot of root and causes for something like insomnia. So it's very, very important if anyone's out there seeking for help or even trying to figure out for yourself, try to figure out what is the root and cause of your sleep issues, because then you want to figure out what the treatment is, right? So root and cause is extremely important. If I have someone that's visually impaired and having sleep issues, to me, it's a high suspicion for something like non-24, because it's so prevalent for people who are blind, right, have no light perception. But if I have someone with history of snoring, then I'm gonna say, well, this could potentially be sleep apnea, right? So there's lots of clues, or it could be, or it couldn't be. So symptoms are very, very important. So what you want to do is, if you're trying to figure out what your sleep issues are, what the root and cause are, you want to do the natural holistic thing first. And we'll dive a little bit more. I'm going to look at my time, make sure, because I can talk for a long time, you guys. You guys will be snoring here. So we want to figure out what the root and cause is, right? And then you move on to the next thing, depending what the root and cause is, right? So realigning to get to your question, first we need to figure out can we optimize it with some of the things that you can do on a regular day to help you sleep better, see if that makes any difference, right? Then try to figure out what is the root cause, look at all the potential reasons why you're not sleeping, and then figure out what is the potential treatment, right? Could this be something like non-24? Maybe not, maybe it's something else. Maybe it could be a complex of different things, right? So it's not an easy thing. All right. What else can we do? What else do you guys do to help you sleep better? Anybody here likes to take a bath or a shower right before bedtime? Yeah, shower or bath. Yes, sir. Yes, Dan.
Me?
Yes.
No. Well, me and my wife solved our sleeping, all right? So she comes in the room, she said, can you sleep? No, I can't sleep tonight. She said, I'll be right back. She goes in the kitchen and she comes right back. She hits me with that cast iron skillet. That worked.
I knew that was coming. I like it. The skillet route. Yes, we've all tried it, ladies, don't we? Sometimes it works, sometimes it doesn't. Yes, ma'am.
I have a question. Can it just be normal? I've never slept as a young child. Maybe 3 hours a night. I can easily stay up 3 days. As I got older, I learned, well, I can work 2 jobs. I'm awake. I might, instead of a 40-hour job, I'll work 2 40-hour jobs. And I've always solved it that way. My cortisol levels are off the chart. They tested them every time of the day, and and I'm just always, they're like, you're the most inflammatory person we've ever seen. But it's just normal for me.
Just call June, she'll take care of it.
The iron skeleton might, I don't know, I've been hit pretty hard. I've had a few concussions. But for me, it's just a normal, I just look at other people and think all that time they waste sleeping. I can clean house or work a job or. So can it not just be how your metabolism is?
Absolutely. So on an average, people need about 8 hours of sleep. But some people are fine with 7. Some people do well with 4, right? Yeah. It's a genetic predisposition. If you sleep 4 hours and you feel fine, then it's fine. That is normal for you, okay? It's when you don't feel fine. It's when somebody asks you out for a lunch and you're like, AM or PM, right? That's when you're like, So, but if you feel fine with the amount of sleep that you get, then go with it. Don't mess with it, right? It's just when you're not feeling, it's when you know you're not getting enough sleep. Yes, sir.
I got a question. Sometime like late in the day, like sometime I might go sleepy late in the day, but like if I'm just sitting around, or then I take a walk or something, I can understand like if I'm just sitting around and not doing much. Sometimes you can get a little sleepy late in the day, but like you were talking about, like taking a shower, that sort of helps relax you, doesn't it? Doesn't or whatever. You do it like late in the day or whatever.
Yeah.
That's what I was asking about, because sometimes I get tired like late in the day, but it's like if I'm not doing a whole lot sometimes.
Yeah, so sometimes people ask me, are naps okay? Absolutely. Take naps all you want. Just as long as they're naps, and when you get up and you feel rejuvenated. But when you take a nap and you still feel groggy, you still feel like kind of out of it, kind of like a zombie or foggy and you just can't get out of it no matter what, that's when that's when it's concerning, right? But yeah, so taking a bath or a shower relaxes your body so to help you sleep better, okay? When you lower the temperature of your room, you sleep better. And the reason is our body core temperature goes down when we sleep. And by the way, our hair and nails grow when we're sleeping at nighttime. So if you try to get some lavish locks here going on, ladies and gentlemen, get some sleep, right? Yes, yes.
I was just curious about the testing of hormones, because I never had any of them tested, I don't think. And doctors don't normally do that.
Correct. So typically something like this would be tested, diagnosed by checking your hormones, but unfortunately it can't really be done in a clinical practice because your hormones would have to be checked all throughout the day and throughout the night for several days and nights. And it's just not feasible when you would have to live at a doctor's office, right? So it's not really practical in practice, but that's essentially how it.
But how do you know? Like, how do you know your cortisol level, or whatever?
You get checked with blood work. The blood work can reveal it.
Well, that's what I mean. Why can't I just get some blood work and get my hormones checked?
Because one blood work is not enough. You would have to get consecutive, because your levels change throughout the day. It's not consistent. So you have to check them throughout the day, throughout the night, and compare them to what normal is. And you have to do it for several days to get a good average. So, absolutely. But sometimes we just check our blood work for different things, like, in functional medicine, we do some extra testing, like maybe cortisol and some other inflammatory markers, may not necessarily pertain to non-24, but just in general, okay? So that may be for some other reasons. Yes. All right, what else yes, sir.
I
Yes.
have one. A lot of things that you've been discussing has affected me. I had lost my vision to a brain tumor, and it's been in '98. And I noticed what had happened with me. I lost a sense of smell, and my hearing increased.
Ooh.
And over time, I had to adjust to it and get used to it. I had complained to it with the doctors and so forth. But the problem that I have with sleeping, the doctor recommended sleep aids to try to help me, as well as I get into all of these different dreams, and it's like I'm aware of what I'm dreaming, and I tend to always go back in past life or my past employers, and I'm dreaming about the same people. And it's almost like I can visually see myself looking at it like a Twilight Zone, like the story going on. And it doesn't complete it, but it's in situations, and I'm like, why do these people keep coming up in my head? So I get that, and I have used some of the sleep aids. I do listen to music sometimes to try to get me down. But what happens with me, one doctor says, well, I'm going to give you these sleep aids and try that. And then he said, try earplugs. So I've done that and got the ones over the counter that were waxed and put in. Those are fine. It cancels out the noises. But of course, you're conscious that they're in your ear. So, and of course they fall out, all of those little things. But I'm very sensitive to noises. And for me at night, I can get a good sleep. But what happens, things get very quiet, and I start hearing noise from the interstate. And I remember when I moved here, I was so used to it in Los Angeles with the planes and the airports and the traffics, the helicopters flying over all the time throughout the night. And I'd asked my brother-in-law, I said, at 5 o'clock in the morning, I said, is there a plane that leaves the airport and for some reason it flies over my house? It's not the helicopter that flies around the city. I had to learn about that they go out and get medical help and bring people in. it was a plane that was leaving. He says, oh, he says, well, the airport's not that close to your house. I'm in Hamburg. I says, well, there's always a plane at a certain time that flies out. It seems like it. And he said, oh, that must be the one that goes to Atlanta. So I don't know if he was joking to me that it's going in the distance that you live, and it's just kind of, you're hearing the back from that. But I do hear the semi-trucks at peak times, at certain times at night. I can hear them coming off the 64, getting into the other, and making that change. And all of a sudden, it's dead quiet. You hear nothing. And of course, in the neighborhood, I can tell each time who goes to work at what time. And I'm asleep by their car doors, all of that, or they're zooming by, and then it gets quiet. So that's what I deal with. And then, of course, not getting the proper sleep. Sometimes I'm sitting on the sofa and I may notice that my vision, I get this kaleidoscope thing that happens, that either I'm tired or my eyes, because I do several different eye drops, that's affecting me. And, or I tend to lie down too early. And then my body just naturally unwinds and goes to sleep. It could be at 8 o'clock.
Yeah.
And I try to stop myself from doing no wait an hour later or 2 hours. So that's always consistent.
Thank you for sharing that.
Uh-huh.
So sounds like you have a very unique, I guess, challenge with this sensitive hearing that you have. I bet you're a good source of information in your neighborhood about what's going on. But sometimes we hear things that aren't there, and sometimes we see things that aren't there. Our bodies are expecting to hear or see something that used to be there. When it goes away, our nerve endings and our brain is trying to create something that's not there. So sometimes some people will say they'll see things, but they know there's nothing there. It's simply because your eyes are trying to create an image. And same with hearing. Sometimes people say they hear music, little very light music. It's just because our brain's trying to create something. Very different from your. I just thought about that as you were telling me about your challenge with hearing. And this is going to be way too much information, but I have to share it with you guys. I am going through menopause, so sometimes my thoughts just flee me just like that, which one just did at the moment. So it's like, wait a minute, where was that? Oh no. So one of the things that people sometimes ask me, sleep is so hard to try to figure out how you help yourself fall asleep. And sometimes people say, well, what if I make myself stay up, right? Because people around us who do not know what non-24 is, who do not know what we struggle with, they will just tell you, they think it's a lack of discipline. They'll just say, just make yourself go to bed at a certain time. Make yourself get up at a certain time. People who have non-24, none of those things, they can't make themselves do that, okay? Because your body has its own clock. So even if you try to make yourself stay up for a long time and then go to bed at the time that you want to, all you'll do is you'll pass out from exhaustion. You're still not going to wake up very refreshed. You're not going to wake up optimized. You're not going to wake up feel good because you're just passing out from exhaustion. So that's why we talk about it's so important to treat the root and cause, right? And non-24 is treatable. There is treatment for it specifically. And for anyone here that would like to learn about the treatment considerations, raise your hand afterwards. I am happy to pass out information or share information. I just don't typically talk about it just because it's beyond my educational scope here today. But I would amiss to say there is treatment available. But the toughest part really is just getting there, getting to the treatment, getting the proper diagnosis. The symptoms are so important in trying to recognize their root and cause, because very often people get diagnosed with lots of things, right? Very often, especially I talk to young adults that have a long list of antidepressants, antipsychotics, very strong medications they're put on, and none of them truly treat the root and cause and still make you feel groggy, right? So I always say, start off with natural, holistic things, see if they help you. And by the way, I forgot to mention this, but someone in a group one time told me that they would drink warm milk before they go to bed. And I was like, what? My mom used to make me drink warm milk when I was little to go to bed, and I hated it. So I went home, I researched it, sure enough, warm milk helps create melatonin naturally in your body. Who knew, right? So that's why it's really important to share things with your peers, because your peers may be doing things that may help you. Anybody, prayer is a great way to meditate. Meditation is a great way. Anything that helps you relax and count. That's where counting sheep came from. It just takes away your brain from thinking about the things that worry you the most to help you fall asleep, right? But in reality, there's lots of reasons why we don't sleep, right? It's not a one single thing. It's a really multifactorial thing. And you are your own best advocate. No one's going to advocate for you like you do. And I hope that each one of you has a good practitioner, somebody that you can go if you need to and talk to that knows you, that you know them. They can kind of look deep into your history and differentiate. Is this stress? Is this anxiety? Is it non-24? Is it the medication? So it's very, very important to have that good relationship, right, with a provider. And in today's medicine, it's not that easy, right? Because they just get you in and out. They have 15 minutes, right? So you have to be educated by the things that matter to you, things that you take care of. Because believe it or not, non-24 is a rare disorder out there in the world in the grand scheme of all the conditions out there. Even though it's so prevalent here, out there, it's rare. So many doctors may never treat anyone with non-24. So it's on us to be educated, to let the doctors know, educate the doctors. So, and I know Susan's looking at her clock, so she's about to take out the key. I get it.
No,
I'm just kidding. I'm just kidding. So I want, and I'm still here, but I just want to make sure I put this out there. Anyone that would like to learn more, things that we didn't cover, if you'd like more information, if you want to speak to a nurse like myself, and by the way, there's nurses out there like myself, they're free to talk to. They can talk to you about your sleep issues, help you kind of through this thought process. They can teach you more about non-24 or help you have a conversation with your provider if you wanted to. If you want information about your treatment or what could be the treatment, what can you do about it? We have that available. If you have a provider that you want educated, believe it or not, people ask me just, hey, can you send a brochure directly to my doctor? And I can send it anonymously to educate them, or I can send it on your behalf so they can stick in your folder next time you see them. You can talk about it. So there's lots of resources out there available. People just don't know about it. So I want to make sure you guys knew those are available. And I also have, and I only have a few, but anybody wants to, I can just mail them to you. I have talking books. They're free. And basically you open them up and they talk about what non-24 is, the symptoms that we talk about, and all you have to do is just open it.
Are you totally blind or know someone who is? Do you go through
So, and then you close it and stuff, but it's a great resource to have. There's some braille on it. Those are free, so if you'd like one, also raise your hand, I'll come around and get your information and mail one to you if you'd like. So there's lots and lots of resources available. So with that being said, any questions or comments, or anybody's awake or asleep? Yes, I have a couple. Yes, sir.
Well, so the talking brochure, does your company make those for other drugs and conditions, or is it just, you're just putting those out for the non-24?
Just for the non-24, yes, sir.
So the 924 is like a pill or something?
So non-24 is it's a condition, right? So it's a condition, and it's just like diabetes, hypertension, or, you know, any other, it's the name of that condition, and it's treatable. And so, just a lot of people don't know that it's a thing. I can't even tell you guys how many people I talk to, they never even realize it's a thing. They just think, well, I'm losing my eyesight, so I guess I'm not sleeping well. I guess it's normal process. It is not normal. It is not healthy. It is treatable. Okay.
So I guess that information is not pure and true, I guess.
Yeah, there is a treatment for it. Yes, absolutely.
Like a pill or
Mhm.
or behavior or management.
So, like I said, you want to start off with behavior to see if we can get you there, and if not, then you move on to the next step. But that's something you want to talk to your provider, obviously. Any other questions? Jokes, singing, karaoke? No karaoke today?
I got a lot of equipment in the car if anybody.
That's for next Wednesday.
Yeah, we're gonna get something going. Yeah, let's
You'll
do
have a
something.
karaoke.
Yeah.
You'll have a karaoke day. I'll have to miss that one. You guys don't want to hear me sing, I promise. I promise. I want to thank you guys so much for your time. I appreciate you guys coming. I hope you walk away learning something today, maybe something you didn't know, maybe something that you can share within your community. If you have people that are struggling with sleep, then you can say, hey, this could be, gotta be not 24. But you can now hopefully share them some of the symptoms and let them know it's treatable. Because like I said, there's a lot of young people out there. I can't even tell you guys. I do these roundtables all the time, and it's, you know, especially young adults when they lose their eyesight, they just truly believe, they don't realize it's a real condition. They just don't realize why they can't sleep at nighttime, and it's a mental struggle. It's very hard for them, and they just think there's something wrong with them. And especially because people around